Hello, and welcome to this PDSA presentation on improving surgeon life-work balance and productivity through variation reduction. So we have the only general surgery practice in our market, so it is only our surgeons that are providing call. In fact, they each work about 5 days of call per month. When they're on call, they often work extended hours, sometimes overnight, and then are expected to be back in the practice or in the operating room next day fully functional. They've reported a lot of negative impacts on their quality of life and, frankly, their engagement in the elective practice. Looking through 3 months of data, we found that there was a significant reduction in their productivity both in the clinic and in the operating room. What we'd like to do is adjust workflows and or the staffing model to reduce the variation on productivity, which would allow us to better fine-tune processes in the clinic and allow OR staff to better manage their processes and provide a better work-life balance for the surgeons and hopefully recapture some of their engagement and enthusiasm for working in the elective practice. The change that we're proposing is we transition 2 of our surgeons to on-call only positions and increase their call obligation from 5 days per month to 10 days per month. So those 2 surgeons would be covering 20 days of the month. They would have no obligations in the elective practice. That would be their only role. The remaining surgeons in the elective practice would each take 2 days of call per month, which would give them a lot more flexibility with their time. And then we would schedule their admin days, which they have 1 every other week, so about 2 per month. We would schedule those as their call days so they have 0 impact on their office visits or their procedures in the operating room. So currently, somebody may have 24 patients scheduled in the clinic, 12 in the morning, 12 in the afternoon, and have a number of interruptions, at least 1. We never go 1 day without a call. But really, they could have 3 or 4 interruptions where they need to go to the emergency room to assess an emergent patient that is presented there. And it could, depending on what they find when they assess the patient, could cancel the entire day because maybe they just have to go right to the operating room. So not only is this a dissatisfier for our surgeons, but it's a tremendous dissatisfier for patients. And again, since we are the only ones covering call, every business day we have this going on with one of our surgeons. And if they're in the operating room, they may have anywhere from 3 to 6 procedures scheduled, and those can be interrupted, canceled, rescheduled, pushed back, delayed. So a lot of impacts. What we'd like to do is, as you can see on the future state flowchart, is if they're on call, they are not seeing anybody in the office and they don't have any procedures scheduled. They are just available for administrative tasks, catching up on charting, and presenting to the ED to cover call. Otherwise, on other days, the EGS, the Emergency General Surgery call surgeon, is covering that call and will have 0 impact on our workflows. So for qualitative outcomes, I do expect that we're going to have improved engagement in the elective practice from the surgeons. I also expect improved life-work balance satisfaction for the surgeons. On the quantitative side, we expect to reduce the variability in our office visit productivity, and I'm looking at that standard deviation as a measurement of the variability I want to reduce that standard deviation by 50%. And I want to completely eliminate on-call conflict with scheduled procedures, because we just won't be scheduling them for call on days when they are scheduled to be in the operating room. Thank you very much for your consideration.